dear nurses, welcome to a new video. In this video I have included questions from maternity nursing. So those who are preparing for hard DHA, MOH, Prometric and MOH NCLEX-RN exam, these questions will be very useful for you. So please don't skip, please watch completely. Without wasting time, we'll move to the questions. Here is the first question. The nurse is aware that an adaptation of pregnancy is an increased blood supply through the pelvic region that results in purplish discoloration of vaginal mucosa, which is known as. So during pregnancy, there are multiple physiological changes. So one of the physiological changes is color change, and that is also due to increased blood supply. So here is a question. What is the meaning of the question? During pregnancy, due to increased blood supply towards pelvic region, there is a purplish discoloration of the vaginal mucosa, and this is considered as, or what is the terminology relating for this? Okay, so there are four options given: Ladin sign, Hegar's sign, Goodell sign and Chadwick sign. Okay, so before selecting the correct answer, you should know what are these signs. Fine. So I'll just show you what are these signs. What is Hegar's sign? It is softening of cervical isthmus. Please write down. Hegar's sign is shortening of cervical isthmus. What is Ladin sign? It is softening of the midline of the uterus anteriorly at the junction of the uterus and cervix. Goodell sign is softening of vaginal portion of the cervix, and Chadwick sign is bluish discoloration of cervix, vagina and labia resulting from increased blood supply. Okay, so Hegar's sign, Ladin sign, Goodell sign and Chadwick sign. So back to the question. What is the correct answer for this question? So what is the key of this question? It is purplish discoloration of vaginal mucosa due to increased vascularity. Okay, so the answer is Chadwick sign. Exactly. So the answer for this question is Chadwick sign. Okay. Next question. A pregnant client is making her first antenatal visit. She has 2-year-old son born at 40 weeks, 5-year-old daughter born at 38 weeks, 7-year-old twin daughter born at 35 weeks. She had a spontaneous abortion 3 years ago at 10th week. Using GTPAL format, the nurse should identify that this client is. See, when antenatal mother enters into the antenatal clinic, you have to assess history, and while collecting maternal history, you can use this particular format. It is GTPAL. Okay, sure you will get one question from this. Okay. So what is GTPAL? G stands for gravida. G stands for gravida, that means total number of pregnancy. And T stands for, it is full term pregnancy. Full term pregnancy, that means it is considered as a term pregnancy. What is considered as term? The gestational age is reaching 38, 39 and 40. It is considered as term. Fine. And P is preterm, that means the gestational age is less than 37 weeks of gestation. Clear? It is 20 to 37 weeks of gestation. What is A? It is abortion, where the termination of pregnancy takes place before 20th week of gestation is called as abortion. And last L is number of living children. Okay, I repeat. G for gravida, T for full term, P for preterm, A for abortion and L for living children. Back to the question. Okay, I will help you to select the correct answer. Here the mother is pregnant, so that is considered as G1. Okay, so either oru gravida aayittu consider cheyyam, and she has 2-year-old son born at 40. So that is G2. Okay, and she has 5-year-old daughter born at 38 week. So that is considered as G3. Very good. And she has 7-year-old twin daughter born at 35 weeks. So it is G4. Very good. And 1 abortion. Even abortion was also on a pregnancy. Appam abortion G5 aayittu consider. Clear? So total G is total gravida is 5. Okay. See, in the option there are 2 G5 options. So you can remove A and D because that rendu G4 aanu. Fine. Apponnile B allengila C. Next what you need to do is you have to calculate the term. How many term? Yes, 40th week 1 term, it is T1, and 38th week it is also second term, it is T2. So how many T's? T2s. How many P's? See, 35 is P. Fine, 35 week is preterm. How many preterm? Single. So P is 1. How many abortions? Very good. Abortion is A1. How many children total? Total 2-year-old son 1, 5-year daughter 2, and 7-year-old twin. So total 2. So total is 4. So the answer for this question is yes, C. Clear? Okay. So sure, your pattern you will get 1 question. Okay, sure, I question. Okay, so next question. When involved in prenatal teaching, the nurse should advise the client that an increased vaginal secretions during pregnancy is called as leukorrhea and is caused by increased metabolic rate, production of estrogen, functioning of Bartholin glands, supply of sodium chloride to the cell of the vagina. So what is the correct answer? So in the question itself they said like leukorrhea. What is leukorrhea? During pregnancy, as a result of hormonal changes, excessive vaginal secretions. That is termed as leukorrhea. So what is the basic reason for leukorrhea? It is hormonal changes. So directly you can select the correct answer. It is production of estrogen. So the correct answer for this question is production of estrogen. Okay. Okay, fine. Next question. 26-year-old multigravida is 14th weeks pregnant and is scheduled for alpha-fetoprotein test. She asked the nurse, what does this alpha-fetoprotein test indicate? So the nurse bases her response on knowledge that this test can detect. Okay, alpha-fetoprotein screening. This particular alpha-fetoprotein screening is usually performed to detect what? Fine. Kidney defect, cardiac defect, neural tube defect and urinary tract defect. All of these conditions are considered as a congenital defect. Okay. See, alpha-fetoprotein is a protein which is normally produced by liver, lung cells and pancreas. Okay, so usually elevated alpha-fetoprotein is indicating some disease related with the liver and lungs and pancreas and kidney. Okay, but during pregnancy, normally we do this procedure. It is considered as a triple marker and this is to identify neural tube defect. Okay, neural tube defects such as anencephaly, spina bifida, Down syndrome. Okay, so what is the basic indication for performing alpha-fetoprotein screening? It is to identify neural tube defect. Okay, so please learn regarding neural tube defect. Okay, so the common neural tube defect is spina bifida. Okay, fine. So next question. At a prenatal visit, at 36 weeks of gestation, a client complains of discomfort with irregularly occurring contraction. the nurse instruct the client to. Okay, so what is the meaning of this question? The female, she is pregnant and at her 36th week of gestation. Fine. And she is complaining discomfort with irregularly occurring contraction. The contraction is not regular, it is irregular contraction. Fine. So during entire pregnancy, there will be chances to get an irregular painless contraction is called as Braxton-Hicks contraction. Braxton-Hicks contraction, which is usually found during the pregnancy. Okay, and at the time of labor, the patient or the mother may develop a regular contraction with the pain. It is considered as true labor contraction. So this Braxton-Hicks contractions can be divided into two, that is false labor contraction and true labor contraction. I repeat, false labor contraction, other name is pre-labor contraction. False labor contraction and pre-labor or pre-labor contraction and true labor contraction. True, T-R-U-E, true. Fine. So the contraction is divided into false labor contraction and true labor contraction. Whereas true labor contraction is the sign of labor and which is necessary for normal vaginal delivery. Fine. So this false labor contraction can be expected during the pregnancy. So how would we differentiate between true labor contraction and false labor contraction? So I'll give you the difference between and the basic necessary thing that you need to remember to differentiate between true labor contraction and false labor contraction. Fine. True labor contraction will be regularly occurring with increasing intensity gradually. And when this mother is doing any activities like walking and doing like stair climbing, okay, so the intensity will increase. Okay, that is the true labor contraction anengila avaru jolly cheyyunnadinusarichu allengil avaru active avunadinusarichu intensity of contraction will also increase. Okay, but if it is false labor contraction, when the mother is doing activity or walking, the intensity will reduce. Okay, false labor contraction anengil avaru active avunadinusarichu idinte intensity koranyondirikkum. Okay, so that is the main difference between true labor contraction and false labor contraction. Clear? So this is the end of today's class, and if you are really interested to continue the live question practice sessions, you can join our classes. We have online and offline classes. In online and offline classes, we discuss syllabus oriented topics, frequently asked questions, and weekly twice we will be having exam preparation sessions, and all periodical mock tests will be available, and the practice material for you all will be sent as PDF. Fine. So before joining the classes, if you are interested, you can attend 1 or 2 days of free demo classes to assess the quality of the class. Okay, so I'll be here to help you out. Thank you for watching. All the very best. Thank you.